Welcome, viewers. How are you doing? I'm doing this little video because it's been 6 months since I had my labiaplasty surgery, and the last video I was in still a pretty bad place, and it's certainly been a challenge. This year has been super difficult. I'm recording this on December 1st of 2023, and I can't even believe all the things I've gone to, but hopefully I've learned a fair amount of how to work with doctors in a way that leads little to error, because I've done all the errors, and I hope you learn from my mistakes. Honestly. So, since my last video, when I saw my primary care doctor, he prescribed Pregablin as another effort to reduce my pain, and thankfully, after a while, it seemed to start working. I haven't had any really big problems with numbness like I had been, or other pain, for about 6 days now, and I'm really grateful for that. It's like you can't ever relax, you can't ever feel whole when you're in such a place of suffering. And the numbness I was feeling was so horrible. And it just always reminds me of all of the horrors I've been through, to be honest. If I ever think about what I've been through with my labiaplasty, then I start to feel just as bad again. But this allows me to not always have that present in my brain, and to not always be plotting out better and improved ways to kill myself. So, mark that as a win. I still don't feel like I'm any better off physically. So, there's that. And I would probably be better off dead, but I'm not interested in actually pushing that along myself. In addition, I continue to see other doctors. I saw a dermatologist for a different problem, a mole that I had, and I had seen them 6 months ago, I guess right before my surgery, and that had been dealt with okay, but I talked to them about some other issues I was having, including the scarring dealing with for both my labia and my top of the scalp, where the scalp advancement was when I had my forehead reshaped and the scalp line changed. So in both cases they prescribed a type of steroid. There were some drops for the scalp, which so far seem to be working on getting rid of the incredible itchiness I have there, and also some cortisone cream for the labia, and we'll see how that goes. I'm just using that daily. Overall, I'm just trying to take it one day at a time and be happy with it, and ultimately the best thing I've been able to do now that I'm not completely inundated with amputation feelings is focusing more on gratitude, being grateful the transition that I have been able to have happen. All of the other parts have been very successful, so I'm really grateful for that. I'm really grateful for the people supporting me, all of my friends and lovers and family, and just it's I'm grateful that people care about me, and I care about them too. It's just sometimes not being alone is not enough when you're in that kind of situation. Sure, you're not alone, but you're still in an intense suffering, and you wish you were dead. So, but I appreciate that. I wouldn't have been able to survive the past 2 months without help. I received a lot of generous donations from you, friends and family, and then a considerable loan from somebody too, which allows me to survive at least. I don't know how I'm ever going to pay it back, but we'll see. I should be starting work soon on this Sunday, so we'll see how that goes. Still looking for better jobs, and ultimately, I guess what this really teaches me is I really wished I'd gone back to my original surgeon first, because that's what I'm going to have to end up doing anyway. I'm still planning on going to see Marcy Bowers, and I'm on the wait list. Usually she says it's about 2 years to get time in the OR. She only does that 1 day a week. So, we'll see how that goes. I'm hoping I can at least be patient enough. Certainly when I got that news, I'm like, how am I ever going to survive that long? But maybe it'll happen. I hope so. I still really want to work on getting things ready so that I could find a lawyer for a lawsuit, but I've just been so exhausted that I haven't been able to do that. I really wish I had help for that, but I guess I don't have the best friend I would need to do that, who has enough time anyway. Everybody's always so busy. And it's okay. I'm working on meeting more people. It's hard to meet people, but I'm doing what I can, and going to groups and getting connected with people online as much as I can, and chatting with people. But it's not easy, and hoping I can find some more groups to hang out with, and that gets better soon. But in the meantime, there's a lot of my own stuff to work on, and hopefully I can start making enough money to actually support myself again. Anyway, overall the whole thing with this surgery has been just a nightmare, and while some of it wasn't as harmful as trying to make the labia minora, it's all been very traumatic. I still don't have any idea what I'm going to be able to do about the shape of my belly being masculinized by Dr. Stranix. He's just so clueless. I guess this is why I think it's a really good idea to never go to surgeons to reconstruct your genitals unless they are also trans. I mean, that's why I did it to begin with, and it was definitely the right decision, because Dr. Stranix has no idea how to treat trans people, and no idea how to be present enough to help us with healing. There's more to surgery than just doing the cutting. You have to take care of patients all the way through, and he was clearly incapable of doing that. And I would recommend to any other people out there who are thinking about getting surgery, absolutely run away from John Stranix. He is a horror show who does not understand trans people and does not know how to communicate what he's going to do and what he understands you want him to do. And I know I'm not the only person who has felt this way. I've talked to a couple of other patients of his that had the same problem. I really wish UVA had the cojones to take care of their patients and not just side with the doctors. It seems shocking to me that they would so easily write off people in favor of their doctors, but that's, I guess, the old boy network that's been set up, and they're like, oh no, we can't be liable. We would much rather have this doctor mutilate lots more people than be liable for damages. So that's the path that they have chosen, and I hope they change that soon. But I'm here to tell you all about it. Well, if you have any questions about this experience, please let me know and in the comments below this video, and I will be happy to share them with you. And if you want to see the entire saga, there is a playlist which will be linked at the end of the video. So, without that, I want to wish you a very merry winter solstice and Yule. May you have the best possible care for any surgery you are planning on. May you have the best communication imaginable with any doctor you have, and hopefully you can make sure that you and the doctor both know what's going to happen, every single alteration with your body that's going to happen in detail before time, so that you don't wind up waking up in your room in the hospital deeply distraught and suffering in pain like I was. So, I love you very much. Aloha. Be well.